As always, knowledge is power. Thank you guys for being here. I'm going to hand it over to Stacey. Speaking of power, today is not today, September 21st is World Peace Day. And in order to commemorate the collective need to heal the world and make it a better place, and just create a safe container for today's conversation, let's start it off with a super juicy and honey-filled grounding practice. I am super pleased to welcome my friend and somatic sex educator, full spectrum doula, and yoga and Ayurvedic lifestyle expert, Stacey Ramsauer, with a guided practice to set our intention today. Welcome, Stacey.
Thank you so much. It's a great honor to be here. I'm really excited to learn from everyone on the panel today and honored to get to open the space this way with what I have found to be deeply healing practices that certainly set the foundation for whatever healing modalities then become our next step. The body is our launching pad. And so the practice that I invite you into today is a kind of meditation, somatic meditation, which means in the body, we will be focusing on sensation and the reality of our body. And I want to set the tone and make it clear for everyone participating, if at any point you experience or sense overwhelm, a need to shift focus, this is an offering to you. So there's no harm done in shifting your focus to take care of yourself. It would only be harm done staying in a place where you're uncomfortable because there's a perception that you have to. So let that be part of our container here. And so to start, just want to invite this subtler awareness of ourselves as embodied, this kind of miracle of conception and gestation and birth, and the way that we each begin our embryological development is the formation of this cylinder, this tube for ingestion and release, and also this sort of pathway of communication that moves us from our deepest internal sense of need to our capacity to express and speak our truth and form relationship. So there is this dual pathway of taking in and having an intelligence innate to us to discern what is useful and what is not useful. And then also our capacity to sense from that internal skin how to communicate and thereby direct our lives using our voice. So we'll be focusing on this central channel in our meditation today. So to whatever degree it's comfortable for you to kind of get still-ish in your body, I just invite you to orient your attention more to a feeling of release and kind of weight in your pelvis, as opposed to anything you might have seen or been told about how to sit to meditate. Really allow for a connection to the ground surface underneath you, even if you're not physically touching ground. Whatever supportive surface you're on, bring your attention there. Bring your attention to the fact of that source of support. And that might be enough to allow you to close your eyes comfortably. If it's not quite comfortable to do that yet, use your eyes to patrol your space and see the light, see the contrast, see the objects, see the doors that you might want to open or close to feel more at ease in your present surroundings. And then if that's enough to close your eyes, it'll be sort of a spontaneous motion. At any point they can open. And then simply acknowledge that you're breathing. You don't need to change it or manipulate it in any way. Although bringing your attention to your breath might initially change it. And see if you can sense for a few rounds of inhalation and exhalation The inhale as a down and in movement. And the exhale as sort of an up and out, a release. As though the ground support underneath you were magnetizing your inhale deep into your body, deep into each cell. And also enabling a safe and easy release of any stagnation, stiffness, holding. And you can always come back to these layers of focus wherever you find the most stability or comfort. I invite you to explore with your own hands the contour and physical reality of your jawbone. So you can just sort of walk your fingertips or drag your fingertips along your jawbone. No particular pattern here, just touching that bone, that bony landmark. It might feel good to do a lot of movement. You might notice an area wants to get more pressure or a really light touch. And this is simply to become really conscious of the full surface area. And then you can release your touch and hold that reality of this bony landmark in your awareness, sensing that bone in space, sensing that bone as part of your body, your physical reality. And then see if you can simultaneously sense the root of your tongue and the space between these two landmarks. As much as you can, stay with sensation rather than your opinion about it. And without moving, without making any gross movements, just feel for the possibility of being able to expand the space between your jaw and the root of your tongue. And what does that kind of ask of you? And then bring your awareness down, just sort of allowing your attention to fall down through that inner cylinder of the body, all the way down to your pelvis. And if it feels good, if not safe, to actually palpate kind of that upper rim of your pelvis, your hip joints, around the waistband at the back. Just bring your conscious awareness to the fact of this bony structure. You could even walk your hands down to the pubic bone. And as you become more conscious of the fact of this bony structure, just notice kind of how you're actually seated in it or not. Is there any shift you could make to be just a little more symmetrical in this space? And maybe you notice it's asymmetrical, and that's all there is to it. And now start in the right hip joint, and it might help to touch it initially. Just see if you can hold that space in your mind's eye. And as though there were a ping pong ball inside your pelvis, just kind of roll that ping pong ball over to the left hip joint. So a little bit of movement. And then from the left to the right. Just back and forth a couple of times, going as slowly or as quickly as feels good. Noticing your own capacity to stay in subtle awareness. And then let that ping pong ball kind of settle in the middle. Just a few movements forward and back. Roll the ping pong ball from your pubic bone and then back all the way up the back of your sacrum to your waistband. There's just a really little bit of movement required. Ping pong ball doesn't take much encouragement to move. You might notice areas of your pelvis that are just sort of not online. You might notice sensations that you've never noticed before. Come back to center, and to whatever degree you have more sensitivity in this kind of seat, your physical seat, revisit this breath, the inhale moving down and in, maybe moving a little bit deeper into your physical structure, or a sense of movement deeper into the belly, even into the pelvis. The exhale, creating a lengthening, a lifting through the inner body, all the way up through your neck and throat and out the head. Just following this really simple movement down and in on the inhale. And up and out on the exhale. Allowing your conscious mind to be drawn deeper into your viscera. And almost using your exhale to bring that intelligence up into your brain. Just take a few more breaths on your own, allowing for the simplicity of focus to capture your attention. And then hold for a few moments an image or the sensation of this central connection running from your midbrain through your mouth, throat, center of the chest, belly, deep into your pelvis, and even into the earth. And allow the rest of yourself to deeply rest for a moment. Aligning your whole self around this central axis. And to bring it to a close, you might bring your hands to rest on your body, anywhere that feels good, anywhere that they simply fall naturally, or you could keep your hands in your lap. Take one more long, slow, deep breath for yourself, in and out. And before opening your eyes, see if you can imagine your space, sense your space from that outer wall of skin. And re-enter your surrounding space slowly. You could turn your gaze down into your lap and slowly lift your eyes as you're ready. And if anybody is game, I'd love to see a word in the chat or hear a word that is present for you. Thanks, Angela. They're great words. Thank you, everybody who's sharing. And you might still just be in it and want to stay there. And I really encourage you to do that if you found some pleasure in there. Thank you, Jackie.
Hi, Stace. Wow. Wow, 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 wow. That was challenging for me. I'm
sure you're not the only one.
I'm so grateful for you and your ability to, I could listen to you talk just all the time. It's amazing. We appreciate you and love you. Please, everybody, go check out Stacey's work. In fact, please take some time to check out everybody's work on the panel. And in the discussion today, we have truly an all-star cast. Check out Stacey at staceyramsauer.com. You can see it on the screen now. And of course, we'll have it listed in all of our post information communication. All right. Woo! Thank you, Stacey, again. Moving on, I bet a lot of you are wondering how you can become a part of one of those psychedelic studies you keep hearing about. We're super happy to have our friend Del from Unlimited Sciences here today to tell you about how to do just that.
What we have done is constructed a study where we can see people will enter information before their intended trips on how they intend to use psilocybin. And we could collect some information before their trip. And then there's a series of surveys after their trip. And what that does is it allows us to understand, again, how people are using psilocybin in the wild. And we find out, wild information from the community that could then potentially inform clinical studies. And so a good example of this is people, I've learned through talking with the community, I learned about a gentleman using psilocybin for facial tics. And I'd never heard that before. I'd never heard of anybody settling their facial tics with psilocybin. And if you cast a wide enough net and you have enough people enroll in this study and tell us how they are using it and what's affecting them, we could start understanding like, hey, look, maybe we should put more time and effort into clinical studies on facial tics and psilocybin. So that's kind of what we're doing, is trying to understand how the audience or how the community are using these substances, and that information informing where we move forward with clinical studies and just a deeper understanding of what that looks like.
Beautiful. I love how you said in the wild. All right, we've got the video queued up, and so don't you worry about it.
Thank
you. Here we go.
Thank you.
Sure. 1, 2, 3,
10, 9, 8,
6, 7, 8, 9, 10. In general, our survey studies can't capture that kind of information. And so this is a unique opportunity for us to provide new information about psilocybin that could be really valuable in our understanding of it.
and to have such a deep personal experience, and to have that person feel that this is, let them check into themselves so deeply and to wrestle with some issues in their life, and they see this psychological value of undergoing this type of therapy.
I feel that it's important that Unlimited Sciences and JHU, our studies, capture this data.
We've been interested in understanding what happens in those naturalistic settings when people are using psilocybin. We're trying to characterize in this specific study prospectively what the kind of before and after of these types of experiences are for people.
If if you're interested at all in the nature of the human mind, how could you not have an interest in what people are saying about psychedelics, especially in carefully conducted research?
If you don't have integration where you take it into your daily life, then it just becomes an experience.
Please join us.
Please go to unlimitedsciences.org to enroll in our study.
Beautiful. Listen, there's so many similarities between a lot of psychedelics, but the consumption of something like psilocybin with ketamine, having a standard protocol or a standard of care, talking about integration. So it's all relevant here. Del, we're super stoked. Remind us one more time where you want people to go and sign up.
You could go to unlimitedsciences.org/our study, and people can enroll if they intend on using psilocybin in the next 6 months. We hope to capture this information. I appreciate you guys allowing us to chat about this. So thank you so much, Jackie.
Thank you, Del. Alrighty. Let's get into it, guys. We're going to do our panel with our all-star lineup. We're going to ask you guys for questions at the end and give the panelists a chance to speak with you guys. We're also going to do some firsthand accounts, one-on-one accounts about ketamine and how it's helped people on the live here today. First and foremost, we have Dr. Matthew Cook and Barbara Brenneman. They are the founders of BioReset Medical. You've heard Doc and I speak on Delic Radio several times, and you'll hear it in the future. Go check out Delic Radio, of course. And we have Dr. David Feifel, who is the founder of Kadima Neuropsychiatry Institute. You have also heard Dr. Feifel on Delic Radio. We have the lovely Angela Ward, who is an RN and founder of Guardian at the Gateway. And last but not least, for this round of discussion, we have Julie and Kevin Nicholson, founders of Ketamine Wellness Centers. Thank you to all the panelists for being here today. We're super stoked. All right, so let's talk about quickly the history of ketamine. Ketamine is a dissociative anesthetic with strong cognitive and psychedelic effects. Though popular as a recreational drug, Calvin Stephen first developed ketamine while searching for an alternative to PCP, which produced undesirable effects. With its discovery in 1962, ketamine went through a series of preclinical trials before the FDA approved it in 1970. It became the surgical anesthetic administered to soldiers in Vietnam due to its relative levels of safety in comparison to other anesthetics. Additionally, ketamine has been used on patients with respiratory and circulatory issues and even made its way onto the World Health Organization's list of essential medicines. Recently, the applications of ketamine have extended to treat depression, even suicidal thoughts, because it takes effect much quicker than other antidepressants and produces what we think are more long-lasting results. People are studying that as we speak. And it turns out that today is World Suicide Prevention Day, ladies and gentlemen. Every 40 seconds, somebody prevents, or I would hope prevents, but actually somebody commits suicide around the world. This is a very sobering and true statistic, and I would imagine that it's possibly gone up since I first heard that statistic. It's very real. The different forms of ketamine that we know are IV, intravenous, IM or intramuscular, troche, which are these little guys right here, nasal, of course, nasal spray, and powder form that you would see recreationally. So let's get into it. Let's talk about the nuts and bolts. Why does it work? Dr. Feifel, you have been studying ketamine in your clinic for many, many years. I would love to hear you talk about why ketamine works, or why you have seen it work and how it works.
Thank you, Jackie. It's a pleasure to be here. You know, it's funny because I had this conversation with some colleagues on a chat group, ketamine providers, and some of them were invoking this concept of neurogenesis, which I'm sure a lot of the viewers have heard. Neurogenesis is creation of new brain cells, which at one time, not too long ago, we thought was not possible. We thought that the brain did not actually generate new brain cells after birth, but then neuroscience discovered that in certain areas it did. And ketamine is known to rapidly produce this neurogenesis. And so it's been a very kind of seductive story to describe, to explain ketamine's profound effects, therapeutic effects with this neurogenesis. And I pointed out to the group that unfortunately, the evidence is really not that, it's a nice story, but the evidence is very mixed about whether neurogenesis has any role in it. And I think what my point to them was really that there's a lot of theories. We know that ketamine does a lot of things in the brain, but the truth is, if we're going to be intellectually honest, we don't know what the mechanism of action for ketamine is. We do know, for example, some characteristics, like it binds to a certain receptor called the NMDA receptor, that it blocks this receptor. Again, that it has these changes, both physiological and obviously psychological and perceptual. But we're still trying to figure out what is the key component to ketamine, and why the experience that people have with ketamine is very similar. And this has been shown in controlled studies, very similar subjectively to other psychedelics, but yet it has a different pharmacological mechanism, at least initially, to where it binds in the brain. So honestly, I could cite several interesting provocative possibilities, but the truth is we just don't know. And it's a great area if you want to be a researcher.
Yes, I thank you for that answer. It's so honest, so true, and I think healthy. It's okay that we don't know, and we do need more researchers and chemists to study ketamine and other psychedelics. Let's take it from an anesthesiologist perspective. Dr. Matt Cook, who of course you've heard also we've talked about this on Delic Radio. My brother, hello, Matt Cook. Tell us about ketamine, why or how, what your experiences with it has been from an anesthesiologist perspective.
It's great to be here with everybody. So ketamine is actually a drug that we used as part of our algorithm in terms of taking care of patients in the operating room. And we've used it a lot for sedation, and then we've also used it a lot as a component of anesthesia. And the reason for doing that is because it tends to be a pretty good pain reliever. And it's the one thing that is a pain reliever in all of medicine that instead of lowering the rate at which you breathe, it slightly increases it. So it tends to have a fairly high safety profile, and anesthesiologists for years and years have been taking advantage of that. And so I've been using ketamine as part of our anesthetics in the operating room since 1998, which is quite a long time ago. That makes me kind of old. But the anesthesiologists started to notice, man, when we give people ketamine, they seem to be a lot less depressed. And so then clinics started popping up all over the country and all over the world that started to do protocols where, and these were generally anesthesia-driven clinics, where we would do ketamine once a week for 6 weeks. And so the concept was to do a treatment, and ketamine seems to clinically decrease someone's depression for about a week or two. And the effects of the psychological and sort of the mental status changes that you get with ketamine go away in an hour, maybe an hour and a half. But then for a couple of weeks, people will have an antidepressant effect. And I have a lot of patients who would come in and we would give them a treatment and they would say, I felt actually pretty darn good for a week or two. we started giving people combinations of protocols where I would use a substance called NAD, which is a vitamin that helps stimulate your mitochondria.
Yeah, NAD.
And the idea is that if I'm stimulating the mitochondria in every area of the brain before I give ketamine, a lot of times what will happen is the ketamine seems to work better. People have less side effects in terms of nausea or headaches or other symptoms that you can sometimes get with ketamine. And then the antidepressant effects will last longer. And it really clued me in a couple of years ago. I treated somebody, and I treated them twice with ketamine and NAD in a week. And then they called me a little disappointed that it wore off. And it was like 8 months, it was 7 or 8 months later. And I was like, wow, that is like a case where with that, we need to publish that, because it gave me an indication. And what we're doing sort of in parallel to all of that is using that time when the depression is off to help retell a new story that is tells a story like, oh, and people kind of will tell me, oh, I actually see that there's a way for me to get through this. I see the light at the end of the tunnel. And so we're turning the lights on in the tunnel while they're still in that kind of fragile moment, and then trying to kind of reset their physiology and then get them out of it. And so I think that my vision of the future is that we will do combinations of protocols that use different vitamins and minerals and strategies, combine that with ketamine, do that in a staged approach, and then while we're doing that, design protocols where people at a social, emotional, family, and spiritual level start to recreate and retell their version of their own hero's journey and how they have a chance to overcome. And the combination of all of that is sort of where we're working with. But specifically on the one front of ketamine, my sense is that it helps people in very difficult situations get a handle or feel a little bit better. And often that is just the helps them overcome the inertia of feeling that they're in total overwhelm, and helps them transition to a better place.
Right. So it occurs to me that we actually have 4 different sets of backgrounds here, all coming and utilizing ketamine to help people in this way. So I think it's useful to get Julie and Kevin and then Angela's perspective on how you guys see ketamine in your practice, how you present it, since we've already established that we don't exactly know why it works, but obviously it's working for you guys. So I'd love, Julie and Kevin, hello, welcome, and let us know a little bit about your practice and how you see ketamine.
Sure, I'll start, and then Julie will fill in where I screw up. But we've been treating out in Arizona since around 2011, and then officially Ketamine Wellness Centers in 2015. I'm a registered nurse by background, so I started being the clinician in the room and we purely do all IV infusions. We don't do the intranasal or any of the oral. That's purely a decision based on our medical directors and our ownership's, thoughts on it. But, we feel the same way in regards to it's unique how it's so different for every patient. And we take an approach by looking at the patient prior to the treatment. We have a clinical psychologist, Dr. Ellen Diamond, who's one of our owners. And we do a psychological interview to look at not only depression, but all the other comorbid mental health factors that may be playing into their wellness, as well as look at their medical and their physical attributes and what may be part of their journey that we have to work through. And then we develop our program based around that. I love the fact that more and more clinicians are getting into this because there is more research, there's more information coming out that will allow us to kind of bridge those gaps in between patients treatments and see if we can get longer and longer benefits. But one of the things that we hear a lot in the psychedelic community is set and setting is really important in making sure that the environment and the physical space when somebody is going through their treatment and getting into that psychedelic realm, that they feel safe, that they feel comfortable with the person that they're with, and so they can go calmly through that experience and make sure that they don't have to feel so tethered. So I don't know if Julie has any other thoughts, but.
Well, set and setting, I got to tell you, is so important. Yes, we talk about it a lot in the psychedelic space, but it's very useful in other avenues of people's lives. It's really about being mindful, present,
Right.
And setting intentions for yourself and keeping yourself safe, because as we say at Delic, safety is cool.
Right.
And that's really what I want to talk about next is safety. Quick personal anecdote for me and ketamine. I use ketamine as a patient with an anxiety disorder and depression. The first time I used ketamine was recreationally. I think I might have been 16 back in the late 90s rave culture in Austin, Texas. And I was young and did not know what I was consuming and just said yes, which is not safe. And it was one of the more challenging experiences of my life. I thought I was dying. I didn't have supportive people around me. I obviously took a dose that was not suitable for me at the time. Was, sat in the back of somebody's car alone while it wore off. And so I had avoided ketamine in a therapeutic setting for the next 15 years or so. And it wasn't until maybe a year ago that I started to consider it, and allowed, the fear had dissipated a little bit. And so it was a beautiful thing to be able to come back to it again in a way that was therapeutic and with people I trust. I've gone up to BioReset Medical with Doc and Barb to do it, and it's helped me tremendously. It's done more for me in a year than 20 years of psychotherapy and SSRIs did not. So let's talk about safety, because I bet there's a lot of patients who come in freaked out, not understanding what they're going to experience. So how, Julie, do you guys handle the safety aspect? And then we'll go to Angela.
Sure. Well, it is, if their first experience with ketamine is YouTubing videos of people on ketamine, they're terrified when they come in. So we do a lot of pre-education and tell them what they can expect, even though it is different for everyone. We give them a lot of scenarios. We spend a lot of time prior to them coming into the clinic, talking to them, answering all their questions, so they feel safer when they get here. The rooms, and one of the reasons that we prefer the IV method is that you can regulate it. If it is getting too strong, you can pull it back, slow it down, those kind of things. I'm not a clinical person, so I don't have clinical terms. So I can let Kevin speak more of the clinical part. But I think making sure they're in a space when they get here tremendously helps on how they're going to react to the treatment. And then we have one-on-one care. So if anybody does start to go a little too far, and just between talking them back down and slowing the infusion rate can bring it back down, because it is, if they said it's very safe if it's done in the right environment and done therapeutically.
Right.
Yeah, Dr. Feifel and I.
Therapeutically.
Right.
Yeah, Dr. Feifel and I I appreciate the time, because we've actually collaborated on a couple of patients in the past, and I believe, I hope I don't misrepresent, but I believe he was giving intramuscular injections for ketamine to a patient, and we dialogued about how to bridge that gap when we're converting from intramuscular to intravenous, because it is a different experience, and the bioavailability and those kind of things we feel, because our doctor is an anesthesiologist, we do require our patients to be on a monitor. We do put them on a pulse oximeter. We do watch their blood pressure because it does cause elevation in blood pressure. And we have a chronic hypertension issue in this country. We find ourselves sometimes diagnosing unknown, and we can help make sure that we're managing that. So
Nice.
but you still want to keep it somewhat of a relaxed setting. You don't want it so clinical that they feel like they're having it done, in an emergency room.
Yeah, it's definitely a fine balance that people across the country are working on figuring out. And because patients are so variable, what the right setting is, again, we're still figuring that out. We don't know. But it's nice to be in an office with medical professionals who can help if something bad goes wrong. Angela, you practice up in the Pacific Northwest. Talk to us about how you see ketamine and how you deal with, while fear is not necessarily a sustainable motivator, it's still, we experience it, especially when it comes to very strong substances like ketamine.
Absolutely. First of all, thanks for having me here. And it's so exciting to hear how everyone is working with this medicine. It's really fantastic. From my perspective as a registered nurse, I'm very much in alignment with helping the patients find their own healing path. And we have to understand that depression is not caused or not healed by drugs. It's healed in relationship and connection. So I love what everyone said about PrEP and integration and providing support and care for people as they move through this process. It's concerning to me, however, that ketamine is the litmus test for psychedelic medicine as it moves forward into the future. And I'm much more interested in a psychedelic model of medicine rather than a medical model of psychedelics. I appreciate that for some people, it's appropriate for them to be in a more high care environment. Maybe they have higher risk factors and need to be more in a clinical setting. Yet many people have a lot of trauma that they've experienced in a medical setting and need to have opportunities to experience this medicine in a more either natural environment or home environment or more like a therapist's office. So that's how I tend to work with people. I work in conjunction with the clinic where we do IM, which I think is really nice because for certain people, having an IV attached to their arms and having a heart monitor and all that can be really anxiety producing. And it sometimes can be really nice for people to be medically cleared, have medical professionals available if we need to intervene. But for the most part, as everyone said, it's quite a safe medicine. And then I work with my clients with lozenges or troches. And that is a really lovely way to work. Yes, those are fantastic because I am concerned that as psychedelics become more available to the public, that people are going to becoming self-identifying that they need to use a particular drug to heal. It's important to remember that psychedelics are tools for transformation and healing, but they are not responsible for the transformation itself. It's really important that people have a supportive environment, and maybe, hopefully when we have MDMA and psilocybin and some of these other things, that the providers can identify what might be the appropriate treatment, but it's not just that, which is absolutely why, Dell, or I can't remember who was saying, Dr. Cook, maybe, that people were having great antidepressive effects at the beginning of treatment, but then it wears off so quickly. And it's absolutely true that people do need to rewrite their story, but they need a lot of support in that process. And so what I do as a nurse is I work with people on building in basic life skills of how to rewire these patterns into action in their everyday life. It's a key component of integration work for any psychedelic therapy. So I've had great success with people in that way. I also want to speak to some concerns I have around access to this medicine. I find that there's a lot of people charging a very high dollar amount for therapies and treatments, which is leaving out a number of people that just cannot afford this medicine. and can't afford this therapy. The great thing about ketamine is it's very inexpensive, and yet people are paying thousands of dollars to have these treatments. I do love that Ketamine Wellness Center does seem to offer, you guys offer a sliding scale or first responder discount, which is great. Yet it's still quite expensive. And I'm also concerned that there's not a lot of people of color or marginalized people that are offering these services to care for those people that need that kind of support. So I would really love a call for more access in different ways that are less expensive and that also are offered by therapists that have some background in trauma-informed care, that have some cultural sensitivity training, and can do this over a period of time.
Yeah, definitely. Access is key, and it's complicated, right? We're at the beginning of this journey here, and with more demand, I believe will come greater access to people. And but also going back to something you said about definitely how ketamine or psychedelics are not the answer. Ultimately, the patient is the answer, I think, to themselves. And it's important also that we have practitioners who can provide other technologies outside of ketamine to help heal somebody's gut biome, for example, which has a lot to do with health and depression, pretty much everything to do with it. So it's not just ketamine. And I think that where more studies will happen, we'll have greater access, but totally heard on the access thing. Angela, thank you so much. And we'll come back to that too, because I know you wanted to talk about the s-ketamine and insurance. But before that, we have a couple of questions I'll give to the panel from viewers. A lot of people asked about interactions. What other drugs can ketamine or should ketamine be mixed with or not mixed with? That's a very complicated question. Does anyone on the panel want to take that? Dr. Feifel, we haven't heard from you in a minute. Do you want to answer that?
Sure. The truth is, there's been some evidence that certain drugs may interfere with the ketamine effect, may mitigate it. For example, there's been some evidence that a drug called lamotrigine, which is also goes by the brand name Lamictal, which is an anti-epilepsy drug, but also even more commonly used as a mood stabilizer and sometimes antidepressant, can mitigate the effects of ketamine. But that's in clinical experience, speaking to a lot of people, and I would say in my own experience, that's not been borne out very well. In fact, and one of the strange things that a lot of people who cite, it was a small paper reporting on some case reports. But it was interesting about that study was it actually mitigated the experience of the dissociative experience, the psychedelic experience, but actually did not mitigate, in fact, enhance the antidepressant effect, which is very interesting and unusual, and part of my interest in, to what extent, is the subjective experience related to the antidepressant effect. It's, I think we think it's important, but we don't know exactly. There's some people who feel that taking a benzodiazepine, that would include drugs like, Valium and Xanax and Klonopin and Ativan, can interfere with the ketamine effect. And that's also, for none of these things, I should say, is there clear-cut scientific, the jury is out on these. But for example, in that latter case, I have found, and a lot of my colleagues agree, that actually it really depends on the situation, that a benzodiazepine can actually enhance the experience and the therapeutic effect when given in the right time. For example, a patient who is at first treatment extremely anxious about it, and we feel that anxiety, is not sufficiently addressed by non-pharmacological. We have a great team that can really work with people to reduce their anxiety, but sometimes it's just so strong that we feel that it would be counterproductive to do the ketamine in that state. And so in those states, we found that pre-treating them with a benzodiazepine actually can turn the experience into a much better one. So I would say there, in summary, I don't want to go through all the list of things. I would say that there's no drug that is absolutely a no-no to combine with ketamine. There are some things that might have some interaction effects, but in the right circumstances with somebody who's very knowledgeable, they could be fine and even beneficial.
Got it. Wow, that's super interesting. All right, let's talk about dosage for a second. Here's from a viewer, a Meet Delic viewer. Ketamine infusions gave me my life back after being bedridden from complex regional pain syndrome. I started October 2016, and the dose that works for me is about 500 milligrams over 5 hours. Most treatments are very expensive, to Angela's point, although I'm lucky to get mine through Kaiser for just my copay. Amazing. Is there any evidence for low dose versus high dose, or does it depend on what's being treated, Barb? You have tons of experience with this, and you also bring an interesting approach with your history of Qigong. What are your thoughts on dosage? There you are.
There we go. Hey. Thanks for the question, and also thanks for all the speakers, and thank you, Stacey, for that lovely break to kind of set us into rest and relax here while we have this conversation, because I think that's one of the things that ketamine tends to allow people, that space. And I think in our experience in the clinic, there is a standard therapeutic dosage, which is the body weight in kilos divided by 2 for people with no contraindications, and many times with novice people who haven't done ketamine, or with people who have lots of anxiety. One of the beauties of the IV therapy is that we can control the drip rate, so we can start them off very slowly, create an atmosphere where they know they're in the safest place on earth. I find a lot of energy medicine things, meditations such as we did with Stacey, will help people to get into that space. One of the things people with anxiety do is say, I don't know what to do right now. What should I be doing? And so doing deep breath work, just doing things to get them in their body is super helpful. And just sort of all the things that we've learned from yoga and Qigong about how to be present and be in our bodies. And then the disassociative effect of ketamine allows, once you're present and feel safe, you to be able to release some of the things that are creating that fight or flight, and can be based on trauma, et cetera. So, my general feeling about dosage is that less is more, particularly when you're beginning. But then you have the other end of the spectrum with someone that has chronic regional pain syndrome, and they need a big dose because of what's going on with their nervous system. But for many people, even this sort of psycholytic dose, where you can stay in a very relaxed, interactive, and let the patient decide how interactive they want to be in that conversation. So, it can range from, they'll talk a lot at the very beginning and then get into the experience and be cool. Or some people will want to talk through the whole conversation, or halfway through the maybe 25 minutes in, they'll be like, okay, I just hit something. Could you hold my hand for a second? Can you just let me know that I'm safe? Could you just ground me? So there's a lot, and this goes to set and setting, but also presence. And I think, for me, one of the most important things is making sure that the person that is with the patient is staying super present. So, there's no looking at your phone, there's no texting or thinking about other things. And that's a wonderful exercise for the therapist as well, because they get the benefit of that meditation and that healing experience. So everyone gets healed in that experience. And then the second point I'd like to make about dosage and about effectiveness is that if you can give people homework. I mean, as somebody who taught yoga and Qigong for a long time, I know that it's hard to establish a pattern of taking care of yourself, but self-care is so important, even if it's just 2 minutes or 5 minutes a day. And it takes it out of, I'm giving you something to fix you, poof, you're fixed. I just baked you a cake, you're a cake, right? It doesn't work that way. You have to actually have some accountability and continue on with your therapy in between the sessions. And so, whether it's, let's work with a set of affirmations, a set of intentions, and, have some accountability back and forth. The effect of the medicine will work for longer and will work more effectively. And so it's not just about come in, do the medicine, feel better, don't feel better. There is because eventually you want to not have to need the medicine anymore. And we get asked that question a lot. How many sessions do I need to do? And the answer is, we'll figure that out as we go along. Let's do one and see how you do. The studies are on 6 sessions or on 12 sessions, but those are on specific conditions and people are so different. So I guess I view this whole ketamine therapy as just another amazing tool in how you can use all of the sort of mind-body tools to help yourself live your best life.
And then I'll tag on that. That's a very good question. And it's, I think, relevant on a number of fronts. And it goes back to the dosage question. And I will echo that I agree pretty much with everything David said. I thought that was good. So complex regional pain syndrome is an interesting situation because what happens with it is that a part of the body gets stuck in fight or flight. Okay, and and the typical thing that happens is somebody gets damage to a limb, either a hand or a foot, and they'll often break a hand or a foot, and then they'll go into that part of their body goes into fight or flight, and it vasoconstricts all the blood vessels, so they don't get any blood, and they end up with a lot of pain. Now, interestingly, the concept, and this came up 15, 20 years ago, of doing really high dose. And so 500 milligrams is a super high dose. And then what the people would do is they would do that dose over 3 to 4 hours. And that dose is almost like a general anesthesia dose. Now, interestingly, on the other side of the coin, and I figured this out about 15 years ago, a lot of people in their 70s and 80s, I'll give them 2 to 5 milligrams, and they'll have an amazing experience that is intense. And they will tell me, if I did anything more than that, it would have been too intense. And so we have a dose range. And now then, if you think of the recreational experience, I'll talk to people all the time that have tried it recreationally, and I'll say, do you have any idea how much you took? And the answer is always no. So to be like, if I said, you want some wine? And then you said, yes. And you said, how much are you gonna give me? I go, I don't know, 2 or 3 bottles, we'll see. And so that's kind of like the state that we're in. I do think, I have seen a lot of people who've done super high dose come in and do lower dose and do great. Generally, at any dose, if you do NAD, you'll do better before. The thing about IVs is you can turn it off. And so if you've had the experience of getting too overwhelmed, you can slow it down. Once through the IV experience, you figure out what your optimal dose is. And let's say your optimal dose is 30 or 40 milligrams. Then we'll often convert and start doing some injection doses based on the fact that we've already proved that they can do that. And so I think we need to have more conversations around dose. The interesting thing is you got to be careful with, sometimes ketamine can potentiate pain medications. And so then sometimes people can have problems with that. But, it's an evolving experience, and the super high dose can be beneficial, but it's generally expensive and a fairly overwhelming thing to go through. And people are often less coherent and almost totally out of it and not as participating as much. And so while I think it can be good, I think that the lower dose algorithms are a better place to start. And even the home, I think, are ultimately things that people are going to be able to do at lower price points. And I think that's going to be beneficial.
Got it. Before we switch over, we got a lot of this question about ketamine in breast milk. What is the effect of ketamine in breast milk or on children who consume it? Anybody on the panel want to take that one?
One of the interesting things about ketamine is that I like pointing out to patients is that Whereas if you take most other drugs for depression or other psychiatric things, or even for medical issues, you're taking that drug every day, and if it's benefiting you, it's benefiting you because it's actually in your blood system, and in psychiatric drugs, it's in your brain. What's really interesting about ketamine and sort of a paradigm shift is, if patients get even a week of benefit from ketamine as an antidepressant, during that week, there's no measurable ketamine in their blood, and this obviously has implications for breastfeeding. Ketamine's effects occur kind of like kidney dialysis, where you go in, whatever the interval is, let's say it's once a week, and you get hooked up for an hour, and your blood gets cleared of toxins, and the next day, if you're feeling well, it's not because you're still getting kidney dialysis, it's because of what happened while you were at the infusion center the day before. You're still doing well, and eventually the toxins will build up. So ketamine is in some ways like that, and that makes it different than other drugs vis-a-vis tolerance, for example, because tolerance usually occurs when your brain is exposed to the drug on a continuous basis. It has implications for this question for breastfeeding, because a mother can get a treatment for ketamine and then waste some of the breast milk depending on the timing, and then new generated milk would be perfectly fine because there's no ketamine in her system to be sort of absorbed into the breast milk. So it's very important to keep in mind the different way ketamine does produce its therapeutic effects.
Lovely. Thank you for that explanation. That's very clear. All right, a couple more questions, and we're going to go into Q&As from the audience. This is another note from a viewer. I'm sorry, I don't know your name. It almost killed me dealing with my insurance company trying to get Spravato approved. I went through a very brief, intense treatment in May, and it worked wonders for me. Why is it so hard to get access to ketamine? I'm a 60-year-old leukemia survivor and have major PTSD and depression. All I want is something that will help me. Well, to this person, we're here for you. We're working on it. All the people of the panel are working on it for you. But it's true. It's new, and so access is difficult. Julie and Kevin, what are your thoughts on how we can increase access to people?
Well, it's when we first opened up, back in 2011, there was maybe 5 or 6 facilities in the United States that were doing this full time. Now that you've got a plethora that are popping up everywhere that may or may not be 100% focused on it. It might be kind of a secondary business and those kind of things. And that sometimes yields different quality of care issues and so forth. The biggest challenge is the insurance companies, because it is experimental, off-label. We've tried the super bills and getting some patients to be able to recoup some dollars for their treatments to offset future treatments and those kind of things. But it requires a lot of work on their side. We have been going through the process of getting credentialed with third-party payers. Currently with our clinics, we've got the 7 clinics in the 6 different states. And we've now become contracted with United Healthcare and Blue Cross Blue Shield. But unfortunately, they're only willing to consider covering patients' chronic pain treatments. They're not interested in working with us in the mental health world. So we're going to try to step into that so that we can see if there's some reimbursement opportunities there that would decrease, like Angela was speaking to, decrease the patient's responsibilities financially, and see whether or not we can get these big third-party payers starting to pay their share.
Yeah.
I can speak to Spravato specifically if you like, because I've been involved in that, and we are now doing a fair amount of that particular drug. To answer to address the viewer's question. Spravato is controversial, but one of the things that is really a breakthrough about it, it is FDA approved, and that really opens the door to medical insurance coverage. And when something gets FDA approved, especially something novel, there usually is a process, a time lag before the insurance companies sort of evaluate it, put it on their policy, get codes for it. I can tell the person who asked the question and the other viewers that there's been tremendous movement in the last 8 months with insurance companies writing policies for s-ketamine and intranasal, saying that it is, we do accept it as a medical necessary thing, and covering it. And I'll tell you where the barrier has mainly been. The problem is that with s-ketamine, the Spravato, the FDA has mandated that there are certain monitoring requirements, so that patients have to stay in a certified clinic to be observed for at least 2 hours, and patients never get the medication to take home, just so some people are not aware of that. And while there's now very good coverage of the drug, there has never been a good mechanism for providers to get reimbursed for that 2 hours of monitoring and having the patient in their office. That's starting to change. There are codes that have been written, and in fact, Medicare is one of the leaders. Actually, it's in a kind of paradoxical twist. Usually, Medicare rates that are not very effective. Medicare now has established good codes and rates. So I would tell everybody that there's optimism. It's going to happen. It's going to be fully covered by all insurances. It's just a matter of time, and we're already seeing great progress. And I think in a year from now, you will see probably complete and thorough insurance coverage of Spravato.
Thank you. Thank you for explaining that. Angela, I hear you have an idea for increasing access. I'm
chomping at the bit. Oh my gosh, yes. Thank you guys for keeping that perspective around access. But of course, this is where we're falling into the problem of the medical model of psychedelic therapy rather than the psychedelic therapy of medicine and healing. So all of us can agree that the healthcare system we are in currently is broken and not getting better. Insurance may or may not cover this, but it is time for bold action from providers that have the ability to prescribe these things. It is relatively safe to use lozenges and do these things much lower cost. We are looking at creating some type of model based on like a community acupuncture clinic where we have a healthcare provider that can screen people, and then maybe using other resources such as psychedelic doulas that could sit with people and support them through their process, working with people that don't have to bill $400 an hour to support someone going through their care. So I think it's really crucial that patients demand low-cost quality access, that providers prescribe lozenges once they've been able to see that patients have been cleared for care, and that the public starts to recognize that these medicines are profound for healing and that people need access to them. We know that the middleman of the insurance companies are just going to increasingly put money in the pockets of the insurance company. It's not really in service of healing. The fact that s-ketamine was pushed through the FDA with the blessing of Trump even, that costs about $800 per dose out of pocket and is limited by the people that can provide it, is really a challenge when truly ketamine is dollars per dose to administer. It's so inexpensive. Ketamine is not approved as an FDA treatment for treatment-resistant depression, but that's because it's off patent and off label. Janssen, the organization that, or the pharmaceutical company that made Spravato, did the research initially with ketamine that showed its effectiveness for treatment-resistant depression. And yet, because it was off label, created s-ketamine so they could charge a ton of money for it. I mean, already s-ketamine has been rejected 2 separate times by the National Health Service in Europe, just including recently yesterday, because of the outrageous cost and expectations for what's needed for the clinical care piece. So I that's my soapbox, but I think there are absolutely ways that we can provide these therapies that are much more in service of healing people's trauma and not lining the pockets of insurance companies.
Preach, girlfriend. Yes. Okay. So you know what I love? I love that we're at the beginning of this journey and there are so many different perspectives and practitioners working it out, because that is what is required to create some sort of general standard of care that keeps people safe, but also allows access. Ketamine is not going to be the first substance that's extremely therapeutic that people can't have access to, or don't have access to because of its cost. And it won't be the last, but I think it's so useful to everybody listening. You are the way. So the more that we have discussions like this, the more you're interested in substances like ketamine for your own therapy or for your loved one's therapy, and you go and you talk about it and you push and you push and you push, the system will respond. And so unfortunately, yes, in the meantime, people are subject to have to get things on the black market, which, as we talked about earlier, is incredibly dangerous because you don't know what you're doing. And if you don't know what you're doing, you can't be safe. But thank you for that perspective, Angela. Okay, so we have a lot of amazing questions from our audience, and I'd like to open it up so that our panelists can answer some of them. Please welcome Madison from my team. Madison, what say you? How's it going?
Hi, Jackie. We have had so many great questions during this stream. Thank you all so much for engaging. One of the first ones I want to throw at you, and this is to really anybody that wants to answer. There's been a bunch of questions about basically how to get involved, whether it's participating in studies as a researcher or people who just want to get into the field of psychedelics. And then someone even mentioned a psychedelic doula. They would like to learn how to get trained on getting involved in these things without having a medical background.
Well, I'm going to be launching a psychedelic doula training in spring next year. So if anyone wants to learn more about that, that's informed by my years of work at the bedside as a labor and delivery nurse and a doula myself, and looking at psychedelic work as a transformational experience, much like birth or death or these experiences are. So feel free to reach out to me and I can share more about that.
I think, Madison, too, this brings up something I wanted to discuss, and that's about ketamine. You know, do you need to consume a substance in order to administer it or prescribe it or whatever, however you're acting as a doula, whether it's as a doctor or as something else? And I think, what do you guys think? Do you need to know the substance before you can prescribe it?
Well, this is something that I've had a lot of conversations with colleagues who've been doing ketamine for a long time, like me. I should clarify. Also, doing is a ambiguous term, but treating people with ketamine. There's one of the things I would say, and maybe some people will be upset by this. I'm a scientist, and one of the reasons I think that that medicine is great is that contrary to what people think, it actually has no dogma. There are dogmas at certain points of time, but we've seen so many concepts in medicine overturned. And everyone who's gone to medical schools had the experience of first day, a big lecture, and the professor saying, everything we're teaching you now was going to be probably considered inaccurate, incorrect, incomplete. That's part of the amazing process of medicine. Ancient medical systems don't do that. They're a dogma. This is the way it is, and it's because you have chi or energy, and nobody asks the question. So I just would say that I'm very open-minded, and I think it's part of the exciting thing about working with ketamine is how different it is and how it involves the psychological state and setting and the patient being a participant. And I explain that to every one of my patients. But there's also, I know there's a lot of dogma that comes from the pre-clinical use of psychedelics. There was when we started seeing these studies come out of NIMH and other place where intravenous infusions of ketamine with no therapy were having remarkable effects. I spoke to many colleagues who were therapists and said it's not possible. They've worked with ketamine. Ketamine is just a lubricant for therapy. It doesn't have its own effects. They now, with the overwhelming evidence, acknowledge that probably isn't true, that even by itself, ketamine can have incredible effects. But still will believe that therapy plays an important role, and so there's a lot of other things. There was beliefs that ketamine cannot have you cannot do it inside a building. You have to be in nature. A lot of these things have been shown not necessarily to be accurate, and so and one of the dogmas is that you have to experience these drugs. And it might be true that that's a positive experience, but nobody's been able to really give me a good explanation for why we have to do that with these drugs, and not, if you're giving cancer drugs, you have to experience the nausea of cancer drugs or so forth. And I had one person say to me, well, if I was, the analogy was, if I was climbing a mountain, I would want the Sherpa to have experience climbing that mountain. My response is, there is no one mountain. Every mountain is going to be different. And if your Sherpa has been up his mountain, thinks that that's what the mountain is, he may actually be a liability, because the mountain you climb with him may be different, and he's assuming that it's his mountain. So psychedelic experiences are different from person to person, and they're different from within a person from time to time. And I could say that in closing, that I've had, there were times where we've thought about doing support groups with people who've had psychedelic experiences. And part of the reason we stopped doing that is that they had such different experiences. It was frustrating to some of the patients. It's like, why am I not experiencing that? So I'm not saying yes, it's important or not important, but we need to put everything to the test. I think all these things need to be evaluated in good experiments, and we're actually planning an experiment where we're going to be, having, the type of therapy, for example, that some people insist intense therapy, whereas more of just a set and setting approach. And I just encourage us to be open-minded and agnostic going into these things. Now get off my soapbox now.
No, I love it. Thank you. Beautifully said. Matt Cook and Barb, you guys have sort of a teaching practice where there's lots of young medical and experienced medical people in your world. So what say you about how do people get into medicine? Would you advise that these days? I know medicine's changed a lot. And then how also to bring in, to take the path towards becoming a psychedelic practitioner. You're on mute again.
I almost fixed it in time. So thank you. That's a good question. I think fundamentally this is a regulated procedure, and so we're going to need to some extent, try to do our best way to follow regulatory guidance and regulatory pathways. That being said, I 100% agree with everything that was said about s-ketamine. I think it's kind of a catastrophe of people just trying to make money on a product that's no better than something that is okay, or something that's generic and great. I have doctors almost every day here, and we're teaching them how to do this stuff. So if people want to come and learn, we're delighted to have you and educate you and coach you in what we're doing. And you can kind of see how we do it. We do sometimes a set and setting approach. I've done a moderate amount of ketamine assisted psychotherapy that I personally think is just about the greatest thing, because you know, I'll talk to people all the time. I have almost a little tiny cottage industry of taking care of psychotherapists that are in their 70s. Like I see, if you said, who do I see? I see people in entertainment, venture capital, and therapists. And it's interesting. It's interesting because this idea that let's say there's a conversation that I'm just emotionally can't quite have, but then a lot of times on ketamine, someone can have that conversation and they can begin to engage in a therapeutic process that's totally different than what they could do just in a clinical room. And I think that on the dose spectrum, interestingly, you can do a lot of amazing things at low dose and at micro dose. And I think that a big area for the future is going to be doing that in a clinical setting with psychiatrists. Eventually, I think that should be expanded to psychologists who probably have more bandwidth to do this stuff. And then I think eventually having some form of medical supervision of doulas and stuff like that, I think is a good idea as well. So that there's appropriate medical considerations being taken into consideration, but experiencing what can happen at a therapeutic, at a conversational level, and at a low dose level. And we're actively engaged in everything from high dose to very low dose and teaching that. And I think it's the future. And I think there's social justice issues, there's political issues, there's medical issues, and there's insurance issues. And it's going to take time to navigate all of those. But I think when something is really good, it ultimately is going to bubble to the surface, and it's going to be something that it's something that people deserve to have.
100%.
Can I take in a real quick comment on that, Jackie?
Please, Barb.
As we've seen practitioners come through here, MDs, ODs, DOs, nurse practitioners, all kinds of different practitioners come through here that want to learn about the practice, because we do a whole lot of different regenerative things. Most of the time, ketamine is one of the things they're most interested in, is they're trying to figure out how to get out of the insurance model of whatever their specialty is, and also bring healing to people in a cost-effective manner. And I can't think of one who, as they learned about ketamine from us, did not want to do a ketamine journey and experience it with us so that they could have that experience to take back into their practice. And I've worked with a number of practitioners who went through that and then went back and started it in their practice. And, there were some calls back and forth, and why didn't this dose work? And was it because I let them have coffee, or many, many kind of conversations that happened around that? But their knowledge and their enthusiasm about bringing this therapy was somewhat born out of their own personal experience, because most people in the medical field are carrying, just like most people in the world, especially in 2020, are carrying some trauma or a lot of trauma. And so as they lighten their load, they're able to be better practitioners and also see the benefits of the medicine. So just a personal observation of that. I see amazing transformations of people from all fields, but I think particularly from medicine, as people are trying to take what was their original intention of becoming a healer, and it's been kind of beat out of them by the system, and to kind of come back to that.
Oh my goodness, there's so much trauma in medicine. And hopefully we can figure that out too, because we need more doctors and practitioners, and Western medicine is not bad. It's amazing. And we need smart people to be encouraged to go and study it more. Amazing. Okay, so in the interest of time and everybody's day, let's do one more question. And I'd love to start with Julie and Kevin after we get the question. So Madison, what say you?
It's hard to pick the last question here. I'm going to kind of combine a couple. The first one, I just want to see if there's anybody that has feedback on how veterans can get support with ketamine treatment. And then the actual question I want to ask is, how can abuse be prevented? What is the potential harm or negative effects from short-term or long-term use?
All right, Julie and Kevin, do you guys treat a lot of veterans?
We do. Like Angela alluded to, we do have a HEROES program that applies to men and women of the military, but also first responders that are struggling with, either depression, PTSD, and those kind of things. It is probably right now about a third of our business that we see on a monthly basis. On an average per month, we're averaging anywhere between 500 to 600 infusions between the 7 centers. So we get a good volume. We've actually been partnering up out of Colorado. What's the name of the company again? There's a 501c3 that we're doing some research with.
The ketamine fund.
Yeah, it's a little bit different. It might be a ketamine fund, but we're trying to do some research with Seroscan and some different companies doing hyperbaric oxygen treatment in combination with ketamine, and seeing if we can get some quantitative studies that we can go back to TRICARE and to some of these, these evil third parties, and see if we can show value and so forth, and get the military's insurance plans and stuff to cover this for them. So, but yeah, we see a lot of them.
Beautiful.
Yeah.
Okay, and one last question for all the panelists.
Jackie, can I just pipe in and say one thing? We actually have a contract with the VA. So that for the last 5 years, I've been treating vets referred to me by the VA. There's been a change in policy, and they're bringing people back to do Spravato actually. But I did want to say that we actually have we're working with a 501c that will underwrite ketamine treatments for veterans. So if there are any veterans locally and they're worried about funds, we have ability to really reduce costs because of this charitable organization.
Yeah, let me just say real quickly, the 501c3 is Invictus. That's what we're working with out of Colorado.
Got it. And Ketamine Fund is another one we're friendly with.
Right.
And we'll put that up on the post communication of this live. In closing, to all the panelists who want to participate, I think we can all agree that ketamine is a wonderful tool in a patient's journey or a person's journey to wellness. You can call that psychedelic wellness. You can call that just wellness. And we all want each other to be well. We want ourselves to be well. So with that in mind, what's a final thought on how we can ride the line between using psychedelics mindfully and creating a new vice or numbing habit with psychedelics? What would you want to leave the people with?
I'll take that one.
All right.
First, am I unmuted? Amazing. So I think to sort of build on the idea of that ketamine is not a cure, and we need to look at all medicine, whether it's plant medicine or traditional medicine, or pharmaceuticals, and that it should be used. We need to look at it as part of an overall program. And so I really encourage people, if they don't have a meditation practice, if they don't have a yoga practice, if they don't have a way to move their body and get into their body and do breath work, that all of those things, and they can be reinforced by the person that's the doula or the therapist or whoever's with the patient during that journey and during that treatment, that, it's just super important to use this as an opportunity to build a strong foundation for psychological health, emotional, mental, physical, and spiritual health. So, for me, my personal experience with ketamine is that I've had a lot of trauma in my life. It's been super helpful with that. And now I use it for my own psychospiritual work. And I think that everybody can do that, even when they're deep in depression. And it may take a lot of troches and a lot of sessions before they can get to the point where they can start to really cultivate those habits. But that should be the end game. And the end game shouldn't be, hey, every 2 weeks you got to do ketamine for the rest of your life. And so, because that will build to a habit, and there is a danger in that. And they used to say ketamine was not addictive, and we all know now that that was sort of like what the cigarette companies were saying. And that all of us high-performing people have addictive personalities, and all the people that come into the clinic that have psychological issues and emotional issues, there's trauma underneath, and there's addiction oftentimes. And we find ketamine really useful as part of our addiction protocols, whether it's for people with chronic pain, so they're on opioids, for people that are alcoholics, long-term alcoholics. We do a lot of things to treat trauma, including stellate ganglion blocks and other kinds of traditional medical procedures and injections, but ketamine is a super useful part of that. So looking at it, as a medicine, but also looking at it holistically is just super important. And I think it's so exciting that we're at the point now where we can have these conversations with people who have credentials in the medical world and have a listening for that. So I'm super excited, even in this year of a whole lot of trauma, let's use this as a way to kind of launch into that full healing.
Let's do it. Love you, Barb. Thank you. Who else wants to go? Angela, what say you? What's your final thought?
Oh my gosh. I love everything Barbara just said, 100%. I think the way that we have to stay oriented to the idea that if we are coming from a psychedelic perspective, that we understand that people aren't getting addicted to ayahuasca, people aren't getting addicted to psilocybin. These things, ketamine is in that category. And I think we're walking that fine line right now, where if we medicalize it too much, it will turn into this pill that you have to take on a regular basis. So the ways that we avoid that is to really make sure that we come in with setting, sangha, bringing in community, having support through the process, and setting intention and integrating in a really deep and embodied way. I think that is a crucial component. And I completely agree with Barb around this is a holistic approach. We need to look at the whole person, and it's not just the individual, but it's also the community and the environment in which we live. And with that, I think that we have potential to do some great healing on the entire planet.
Beautiful. Thank you, Angela. Julie and Kevin, what's your final thought and what's next for you guys?
Well, final thoughts. Well, we are probably going to be opening 3 more clinics in the next 3 months. So we're going to be busy. So we're hoping that we'll be, we'll help with some of that access to care. But I think our biggest thing is, as the community continues to learn about ketamine and other options for mental health care and improvement, we need to have the community ask questions. They need to know the questions to ask. And there's a lot of different providers that are throwing up their shingle on, in a building and doing this, and maybe doing it for the right intentions, or maybe doing it because it's just an extra revenue stream. And we feel, everybody on this panel has been talking about the amazing results that we all see. You can see the passion in everybody. It would be very detrimental, I think, if too many providers got into this for a cash-based reason and so forth, and we started seeing some negative press and negative outcomes. So we got to set those qualities, we got to set that standard of care, and we got to keep communicating with the community to make sure that the community understands what questions to ask of a provider if there's multiple providers in an area, to look for the best option for them, whether or not it's intranasal, intramuscular, intravenous, or troches or whatever.
Right. And I 100% agree on the wellness component. It's so important that the ketamine is just to get you over that hump. So then you can look at your nutrition, you can exercise. A lot of our patients come to us, and if on day 1 we started saying, you need to eat better, you need to exercise, that wouldn't go anywhere. So there is a process to get them to the point where they can look to that. And I think it's also important to know that the ketamine customer base is not your person who's comfortable dabbling in psilocybin. They're from all walks of life. And a lot of them actually, prefer a more, not a clinical setting, not necessarily like a hospital setting, but something that gives them a little more comfort that, this is real. This is, there's some legitimacy to this treatment. And, everybody's comfort level on any kind of psychedelic drug is way different level. So, it's important to have a level of legitimacy too, that will take this treatment, to where it needs to be mainstream.
Definitely. Mainstream psychedelics, that's what we're all about. Thank you guys for being here. Last but not least, Dr. Feifel, what is your final thought and what is next for you in your practice?
In terms of final thought, in terms of practice, we're going in several different directions. We are also expanding Kadima, planning on opening additional sites in the next 18 months, but we're also doing a lot of research. We're actually have got a couple studies now with psilocybin under the FDA in collaboration with Compass Pathways, and really trying to learn as much about it while we are treating patients. And I've been doing this, as you know, since 2008. I created the first ketamine clinic outside of research when I was on faculty at UCSD. So this has been year 13 for me doing this. But there's still so much to learn, and I think that's part of what really excites me is we're already able to help people phenomenally, but I also realize there's so much more to optimize, and that's a big part of what we do at Kadima. I guess in terms of final thoughts, I would say is I'm going to take a little bit of a different stand from Barbara. I think there is danger to opening up ketamine too much. We just published a study surveying a number of ketamine providers around the country, long-term effects, because there's no prospective studies. And one of the concerns, as you know, from some of the skeptical people is that, there's going to be a lot of addiction, and we found that the very few cases of addictive behaviors as defined sort of, formally by the DSM-5. And the only ones that were ever reported were around home use that was done in conjunction with the medical visits and in clinic use. And a lot of the providers who had done it had backed away because patients, when they had access to it unregulated, tended to want to do more and more of it. I totally agree about sort of we need to incorporate some of the knowledge and wisdom of of what we know with psychedelics, but that can be done into a medical model. And the reason that ketamine is where it is today is because of studies done by psychiatrists, at places like Mount Sinai Hospital and NIMH, and things that we published at UCSD. It's why ketamine is where it is now, and psilocybin and those things are where they are now because of studies being done at Johns Hopkins under very sort of, under the tradition of medicine being open to inquiry, but being skeptical and asking the questions. So I think the best route for these medications is through a sort of a regulated and well thought out medical umbrella to provide increasing access. And I think that will happen. So I would point out that the very first person who really discovered the mind-altering qualities of ketamine, John Lilly, actually his life got ruined because of ketamine and excess use he could not control. So it's not as benign as we like to think when there's completely unfettered access to it and home use and so forth.
All righty, thank you for that. Thank you to all of our panelists for being here today. I know you're all busy working, making the world a better place. We really appreciate your time at Delic. Thank you so much. And to the listeners who want to know more about our panelists, we will again communicate that to you post the live event. Please welcome Ian McCall and Irena Reina to talk about their personal experiences with ketamine, how they've helped, how ketamine has helped them. We got a lot of questions from you guys wanting to hear firsthand accounts about this substance. It's one thing to hear about how it works in the body or how it's regulated. It's another thing to hear another human really talk about how it's helped them or not helped them. So welcome Ian and Irena, and we can't wait to hear your story.
Thank you. Thank you so much for having us here. It was so wonderful to hear everybody. So many components were incredibly relatable to my personal experience and also to the experience of others that I've helped integrate their ketamine and other psychedelic experiences into their lives. I would like to talk about some of the classic experiences, of course, in having used ketamine to treat my depression and PTSD. But as Del has mentioned, how interesting it is to actually mention some of the lesser known or used applications of some of these substances, like psilocybin for treating facial tics. In my instance, the big part, one of the most transformational experiences that I have had involves using ketamine for treating depression that was caused by sexual trauma and experiencing the most profound form of psychosomatic release that I have ever had, which became a turning point in my healing and my ability to manage certain manifestations that my body was struggling with. And as all of you have remarked, ketamine experience can be incredibly different depending on the mode of application, depending on the setting and the dosage that's used. In my specific case, coming from a deep history of sexual trauma that was never truly processed, it has, the large dose was needed to bring me to that place of actually being able to process certain experiences that have happened to me as a child, and being able to be in that beautiful space of psycholytic and psychedelic experience at the same time, being able to witness what my body was going through in a very intense psychosomatic form. For example, my hands have completely curled up, which I have never experienced before. And I have used ayahuasca and psilocybin, as well as psychotherapy and EMDR for processing, for trauma reprocessing. However, in this instance, it was the first time that after many years, I had the opportunity to actually speak about what has happened in these instances. And following that occurrence, I had a treatment, and that intense form of psychosomatic experience is something that has allowed me, just like one of the panelists had mentioned, to literally turn on the light in a tunnel and to be able to be there, to verbalize what was going on with my body, to actually feel that place of being stuck that has happened to me. And at the same time, to ask the person who I felt safe with at that time, can you help me? I have never asked for help. I have never really reprocessed that experience. And to feel that release of actually becoming unstuck and coming out of that place of my body freezing completely was incredibly profound for that specific experience. So that has resulted later on in being able to implement some of the very new sensations that my body has received during that specific treatment into my integration practices. I have practiced yoga, breath work, and meditation for over a decade, yet I have stopped dancing. I have only used my body in a structured manner, meaning following yoga routines and following a structured practice that my body was engaged in. But I have stopped dancing completely. In my early 20s, when I started raising children and got involved in R&D and academic career and got really busy, I became a classic model of what Dr. Gabor Mate calls an addict that becomes a workaholic, and in which case sexual trauma becomes a sexual addiction. I kept my mind busy. I kept my body super busy and super efficient. However, I never reprocessed those traumas that have caused me in my later life, in my later adult life, to experience depression and PTSD and severe signs of trauma. So this experience, even though, as I said, I've done ayahuasca and psilocybin before, after ketamine, I've actually started to dance. I've actually started to express my body. Ecstatic dance has horrified me, even as a devout yoga and breathwork practitioner. Just a few years ago, being in the circle of everybody dancing ecstatically absolutely horrified me. My body was stuck. It was frozen. It was impossible for me to do that. So anyhow, I started to dance again. A couple of memories that came up during this specific encounter were also very profound. I have never remembered that in my early childhood as a 5-year-old ballerina, I've danced for a dictator in the country where I was born, Yugoslavia. I was 5 years old and I was one of the ballerinas that had to dance for a celebration of his birthday. I had some vague memories of my body form and shape being scrutinized by this group of gray looking people, but I never quite tapped into that memory, what that was. And then later on, when I was 15, my first modeling gig, again in Eastern Europe, was in front of a sea of Eastern European diplomats. And again, here is the body that got frozen because of the form being scrutinized, and so many other interesting things that have popped up in that profound moment. But anyhow, I'll leave you with that. I think this was something that I wanted to share as a very unique way of liberating my body and also lessening signs of depression long-term.
I got chills. I got chills. I love that you're dancing again. I've talked about this on Delic Radio a few times with an actual, I say an actual dancer, but I'd like to think that we're all dancers. As much as we can move our bodies, we should. And there is a connection between consuming psychedelics and, like you said, relieving your body or allowing your body to come back to life again. Thank you so much for sharing. Ian, what say you?
All right. So I've got to deal with a lot of different things. Pain, one of them. Depression, another one. Addiction was, I would say, my biggest, because, you know, for my entire career, I was addicted to painkillers. From 14 to 34, my sporting career, the greatness of becoming a world champion, trying to go, you know, college, Olympics, whatever. My body's broken. I don't hear any doctors talking about inflammation, the anti-inflammatory effects. I'm sure this is all theoretical, I guess, because I'm just reading it off of books, but the anti-inflammatory effect, when those receptors do get turned on, that's everything in the body that's bad is tied back to inflammation. We all know that. I'm not telling you anything new, but this is what I see is with the pain, with the depression, with those things, having those neural pathways less inflamed, having the body less inflamed, getting that stress response down, you know, dealing with that sort of stuff is what worked with me. I got past my addiction to opiates a while ago.
And was that, are we talking about your ketamine therapy or just general therapy using other substances?
Ketamine therapy specifically.
Yeah.
The other psychedelics, as again, I've read, whether it's LSD, Aya, psilocybin, ketamine, they all have this anti-inflammatory effect on your body. I believe it's true. And to knock that down, not just through, you know, diet and exercise, but through these forms, high dose CBD, you know, is how I fixed my daughter with juvenile rheumatoid arthritis. But with me, back to the addiction part, was the biggest, most profound thing with ketamine, where sure, it was with a very large dose, but I was able to pull out and look at these issues that I thought, oh, I've got these, that's no big deal. I'm good. I'm fine. I'll be great. You know, I was in the hospital recently, and I have a stress disorder, which causes immense pain in my body. That's just my stress response. It's H. pylori in my stomach, gallbladder, what have you. I took morphine in the hospital, and I'm like, yeah, give it to me. It's fine. I'll deal with it. It made me feel so gross. But then I was able to come home, and I don't want the morphine or any sort of opiate, but it was a door that opened into my addiction that I realized I hadn't dealt with yet. I was able to pull out and look and go, stop. Number one, stop calling yourself an addict. Like that's not it. You're maybe a psychonaut, sure, but it's responsible. There's safety behind it. There's real integration behind it. This isn't, you know, me trying to be a party boy anymore, you know, douchebag, basically. It's me fixing myself and helping fix the clients that I have, whether they're an Olympian or they're this or that or the other thing, you know, becoming an integration coach and really learning about these sort of things, learning about the feminine. I mean, I was like, again, I was a douchebag. I was fighting my whole life, beating people up, climbing into a cage in my underwear and hurting people for a living, for blood money, for everyone else's viewing pleasure. They don't understand that there's PTSD.
Not enjoy MMA at all.
No, I have so much fun. But I was tortured. You know, I get obsessed with things. And there was three things I wanted to be. And that was a scientist, that was a comedian, and that was a fighter. So I got the fighter thing down. I got into comedy and realized I don't want to be that person anymore. It brings out some gross things in me it's not comedy's fault, it's my fault. But, and again, I'll never be a scientist, but now I'm a scientific researcher, and I get this obsession with things. I mean, thanks, I have a good teacher in my life. But just to really understand these things and to be able to pull back, ketamine has let me really, I mean, look at myself, where I was always just in the bubble of a psychedelic journey going, this is so cool. Okay, great. Like there's no work done to be done after, you know, I'll be fine. And that's not how it is. It's about doing the work, just like, you know, repetition is the mother of skill.
Yeah.
That's how you get good at anything. And for me, this is how I had to do it more than once.
Yeah. So, wow. Thank you for sharing. There's so much there. I want to go back to the inflammatory, anti-inflammatory comments you made about psychedelics. To my knowledge, though, we can't actually confirm that. There are psilocybin, for example, when consumed, the actual mushroom plant matter can cause an inflammatory response in people who have a gut biome that's not healthy to begin with. So I think in my experience, there are some inflammatory responses, but I like to think about it, and maybe you agree, that it's having sort of a spiritual anti-inflammatory effect on your spirituality, which is amazing, because if you're not inflamed, then you can flow in flow state and experience life and wellness.
Yeah, I would, that dropping of the fear response right there is the anti-inflammatory effect. Getting that cortisol down, stress hormones down, that's a huge part of it. You know, you go test someone's blood who's constantly depressed. Their inflammatory markers are through the roof, you know? And that right there is just I forgot who was talking about earlier, but you're able to give and receive the information, whether it's with a loved one or some random person walking down the street. You're able to deal with those issues and just kind of, you know, pull them out, whether you're putting it on top of some other psychedelic or you're just doing it on its own. You're able to pull out and look at these issues and just go like, all right, like I can deal with these. It's just emotion. You know, we are emotional beings, and we need to learn to compartmentalize our emotions and deal with them individually without letting them give us this emotional response in our body, because that's, as we've seen and how we've been programmed, that doesn't work. It doesn't work for anybody. It doesn't work for you or the people that you live with or the people that you love, you know?
Yep. Well, I'd say that go easy on yourself, Ian. You've been through a lot, and your body has been through a lot. Your brain has been through a lot as doing the kind of sport that you've done for so many years. And I'm so glad that psychedelics have, you found a newfound wellness with them, both of you. And that's what we can hope for, right? That's what, you know, we're not here to tell people what to do or how to do it. I think the more we all talk about our experiences real time and come out of the psychedelic closet, the more other people will feel more comfortable doing that themselves, and so on and so forth. And then it will become mainstream, and people in general will have the opportunity to be more well using substances like psychedelics. Well, thank you guys so much. Where can people find out more about, I know you're in the psychedelic field working, so where can people find out more about what you're doing?
There's my website. It's called the McCall Method. I feel silly saying the McCall Method because it's half hers anyways, or there's other people in my life that help me do this. I just happen to be the guy with the soapbox with the blue check mark. So I want everyone to know that I have the best professionals around me helping me with this, because this isn't just about me. You know, this just has my name on it for some silly reason. But
well, you gotta call it something. I think that's
exactly. It's just a the McCallmethod.com. Check out her Instagram at Myco Stoic. Myself, Uncle Creepy MMA. I'm trying to change that. It's just my old nickname from fighting. It was a long story.
Not going away.
I'm trying to get rid of it.
Also kind of a good name, Ian. Also kind of a good name from a brainy
I wanted it to be Reverend Ian McCall because I'm working with a plant medicine church out of San Diego.
Okay.
Native American for the ONAC, but I don't know if I want to be called a Reverend.
That's teetering on, you know, guru stuff, and I don't know.
Yeah, I cannot have guru complex. I need everyone to hold me accountable here.
Yeah, in that sense. Yeah, one of the stories when I started intensely meditating and during breath work to address the signs of my depression and trauma, my Eastern European mother immediately said, "That is so damaging for you. You're going to end up running away with a bearded guru one day. What are you, in the cult?" So yeah, oh mom.
True. Beautiful. Well, we love you guys. Thank you guys for taking time and telling your story. Thank you again to the panelists and everybody who shared time with us today. Thank you to the Meet Delic team. We couldn't do it. I couldn't do anything without you. Don't forget to visit meetdelic.com to view all of our previous live events for free. And of course, take a bite out of consciousness when you visit realitysandwich.com, where we have guides on ketamine, other substances, and we will soon have how to get into psychedelics up on realitysandwich.com as well. To the viewers, you guys are it. You are the future. You are the now. Thank you so much. Be kind to yourself. One love, all love.
Thank you, everyone. So great.